Hello, and welcome to another episode of Intuition Nutrition, the mini-series. I'm here talking with Lily Nichols, who's joined us from Alaska, but she's originally from LA. Lily is a registered dietitian and nutritionist, a certified diabetes educator, and a certified Pilates instructor. But Lily, well, first of all, welcome, Lily.
Thank you.
I'm really excited to have you on the show. So I understand that your specialty and interest really lies in helping women who are having children. Is that correct?
That's correct. Yeah, mostly prenatal nutrition.
Prenatal, and also prenatal diabetes, right? Gestational diabetes?
Gestational diabetes. Mm-hmm.
So tell me a little bit about how you got to this point in your life. Have you always been interested in this sort of health and wellness field?
Actually, I got interested in nutrition very early on when I was still a teenager. So I ended up pursuing a nutrition degree for college, and then did my registered dietitian program. And then from there, I mean, my interest in nutrition kind of was already on the whole foods, real food kind of side of things from the beginning. So when I was studying nutrition, I actually got introduced to some additional research by Dr. Weston Price. And he's somebody who studied traditional diets, and he specifically found a lot of these cultures ate very specific foods during pregnancy to promote a healthy pregnancy, and that would actually have carryover effects to the future generations. So the healthier the mom would eat, the healthier her children would be, and then the healthier her grandchildren would be. Right. So that really led me in the direction of pursuing prenatal nutrition, because I saw so much of our health problems can be related back to actually what our mothers ate or what our grandmothers ate, which is pretty cool. So after I did all of my traditional training, I started working in prenatal nutrition. I worked with the California Diabetes and Pregnancy Program, which is a program specific for women with gestational diabetes or any woman who has any type of diabetes during pregnancy. And that's when I got introduced to this whole broad field of prenatal nutrition at sort of a deeper level, at the clinical level, at the public policy level. So I've since specialized in that area because it's so needed.
Yeah, absolutely. I mean, I can tell you, I've had 2 children, and when you are pregnant, they tell you, watch out for your sugar levels, and they give you sugar tests, but you don't get a whole lot of education about how to control that.
Right, right, exactly, yeah.
So how do you reach out to these women? How do you work with them?
Well, currently I work with them remotely. So I have a private practice that's phone and Skype based. So I have people all over the country, really, that I can work with. Prior to this, I worked at the clinical level in, a women's private practice under a perinatologist as their diabetes educator and prenatal nutritionist. So kind of like the full spectrum of how you work with these ladies. I also do a lot of education with healthcare professionals, doing trainings like webinars or conferences speaking on the topic. So other health practitioners know, the best ways to work with women with gestational diabetes and help them heal with real food.
That's awesome. And what's the success rate? I mean, if, say, somebody was told they had gestational diabetes in their, what is it usually, in their second trimester it comes up?
Yeah. Or? They usually diagnose it between 24 to 28 weeks. Some people, if you have a really progressive doctor, they might screen you in your first trimester, or if you have any health risks that put you at a higher chance of developing it later on, they might screen you early in pregnancy to check your sugar levels right then. And then from there, I mean, the primary treatment is food. It's nutrition. And then secondary to that is exercise. And then the third thing you might explore is medication if you can't keep your blood sugar levels under control with food and exercise. So really the first thing you do is change what you eat. I mean, it's as simple as that. And it's actually, it's not too complicated when you really get at the root of what gestational diabetes is. And, one of the definitions is carbohydrate intolerance in pregnancy. You just really have to watch the carbs, emphasize real food, the foods that keep you full for a long time, lots of vegetables, healthy proteins, healthy fats, and just being careful about those sugars and starchy foods. And there's a pretty good success rate just with food alone. For some women, no matter how perfect they try to eat, we can't manage it just with food and exercise alone. So for some women, they're going to need a little help from medication such as insulin, and it's temporary. It's during their pregnancy. It's not a big deal, really. But keeping those blood sugars in very specific levels is really important to the developing baby by whatever means you need to be to get there.
And just because someone takes insulin doesn't mean they can forget about what they're eating, right? Doesn't mean they can just go crazy and binge on Snickers bars. Am I right? Or
in some ways, they almost have to be more careful because insulin lowers your blood sugar. So if you're not careful about eating foods that raise your blood sugar when you take your insulin, you can bottom out and get low blood sugars. So they almost need to be more consistent with the quantity of carbohydrates each time they eat than somebody without insulin. But certainly some people will sort of work the system a little bit, and if they know their carbohydrate tolerance and how much insulin they need to take to keep their blood sugar at normal, it does give them a little more room to quote unquote cheat, or maybe indulge a little bit in some sweets every now and again and just take a little extra insulin. I mean, that also can be done. Right.
Well, I see that it's not really down to science for each person the same thing. I mean, it sounds like each person is an individual case.
Oh, it's completely individual. I mean, I've worked with hundreds of women with the diagnosis, so there's some general rules that hold true, and then no matter what, there's always an exception to the rule. Always. So I've seen them all.
You've seen them all. So I have a question. Yes. I know it's inherent in the definition that gestational diabetes happens during pregnancy, but are there cases of women who, after giving birth, continued to have diabetes?
Yes, that's a very good point. So, gestational diabetes is really interesting because it does affect a woman's lifelong risk of developing diabetes later in life. So about 90% of women, when they deliver, when they usually do a glucose check at about 6 to 12 weeks postpartum, and then they'll repeat it usually annually after that. But at that first check, 90% of women will come back to normal blood sugar. Oh. However, what happens in the following 5 to 10 years, women who had gestational diabetes have a 3 to 7-fold higher risk of getting type 2 diabetes.
Ooh, wow.
Within 5 to 10 years, when their child turns 5 to 10. So there is a much higher risk for having blood sugar issues later in life. So there seems to be right when you deliver, and the pregnancy hormones, you deliver the placenta, and the placenta has all these hormones that affect our body's insulin, which is the hormone that controls our blood sugar. So once you deliver the placenta, those hormones come crashing down, and usually the blood sugar will go down. Plus you're breastfeeding, or if a woman is breastfeeding, then her blood sugar will also be temporarily lower. But over time, there's still that lifelong risk. So we don't fully know why that is, but a lot of doctors and researchers are thinking that gestational diabetes is maybe like the earliest sign that a woman is predisposed to prediabetes or type 2 diabetes. Luckily, it's not fate or destiny that a woman's going to get type 2 diabetes later in her life. Essentially the same way that she eats during her pregnancy. Being careful about the carbohydrates, really emphasizing, well-balanced real food meals, most of the time prevents type 2 diabetes later on. And a big part of that is just keeping your weight at a normal level. So, losing the weight you gained during pregnancy, keeping a healthy weight, eating well, exercising, those things all drastically reduce the risk of diabetes long-term.
That's wonderful. And so what you do you coach women who are going through this to help them find a balance in their lives? Is that what your private practice is about, coaching or educating?
Yes, it's mostly nutrition coaching. So mostly prenatal nutrition and gestational diabetes. I also work with people who have digestive issues and food sensitivities. So it's not fully pregnancy focused, but because I just was kind of lucky in my career to be exposed to so much gestational diabetes research, I do tend to gravitate towards that, and I've recently written a book called Real Food for Gestational Diabetes, which will hopefully reach a broader audience of women, not just the, close group of women that I work with.
That's awesome. Where can people find that? Is it on your website?
It's going to be, well, you'll find a link to it on my website, pilatesnutritionist.com. It's also going to be up on Amazon. So we're down to the final days. It's almost up there and ready for purchase.
Oh, that's exciting. Oh, good.
Yes.
Well, I hope people check it out. Well, Lily, thank you for chatting with me today. So can you tell us again your website so we can put it up there for everybody to see?
Yep, it's pilatesnutritionist.com. And for women who want to learn more about the prenatal nutrition part of things, there's a link on my website called Freebies. I have 4 different ebooks that are available for free. One of them is specifically for pregnant women. It gives you a bunch of different snacks, 33 snacks that are healthy and actually taste good. And they're designed specifically to keep you full, help you with food cravings, help you prevent gaining too much weight, and also keeping your blood sugar at normal levels. So good if you have gestational diabetes or just any woman who's pregnant.
That's wonderful. I'm going to go check it out myself. Thanks, Lily. It's been such a pleasure to talk with you.
Thanks for having me.
Yeah, my pleasure. Take care. And please tune in for next time. We'll have more food for your mind, body, and soul.